Why are my copayments different between the provider and insurer? Ever wonder why the amount you pay at the doctor's office doesn't match what your insurance company says you owe? It can be confusing, but understanding the reasons behind these differences can help you manage your healthcare costs better. First, it all comes down to how your insurance plans negotiate with healthcare providers. If your doctor or hospital is in network, they have a contract with your insurer. This contract sets discounted rates for services, which means your copayment is usually lower. For example, if your plan says you pay $10 for a doctor visit, that's because the provider has agreed to accept that amount as full payment for covered services. But if your provider is out of network, things change. Out-of-network providers don't have a contract with your insurer, so they can bill you for the full cost of services. Your insurance might cover only a part of that, leaving you responsible for the rest. Sometimes, your insurer covers less or none of the out-of-network charges, which can make your copayments higher or lead to additional bills. Your insurance plan also influences what you pay through its design. Different plans like Medicare Advantage, Medigap, or supplemental policies each have their own rules. Medicare Part B, for example, usually requires a 20% coinsurance after your deductible. Some Medicare Advantage plans use fixed copayments instead. Prescription drug plans, known as Part D, have different copayments based on whether you're getting a generic or a brand name medication. Another factor is how your benefits are coordinated if you have more than one insurance plan. Usually, one insurer pays first, called the primary plan, and the other pays second, called the secondary plan. This process can affect how much you pay at the time of service because the secondary insurer might cover some remaining costs. Billing practices also play a role. Sometimes providers bill you based on their full charges before insurance adjustments. Your insurer then calculates your copayment based on negotiated rates and coverage rules. This can sometimes make it seem like your copayment is different from what the provider initially billed. Knowing these factors helps you understand why your copayments can vary. Always check if your provider is in network before your appointment. Review your specific plan details, especially if you have Medicare or supplemental coverage. Don't hesitate to ask your insurer how copayments are calculated. If you see a difference, contact both your provider and insurer to clarify your financial responsibilities. Being proactive can help you avoid surprises and better manage your healthcare costs.